computer is what I want to do. And are we recording? Yes, we are recording. Okay. So let me get into the, let me share my screen. And we will get into this slideshow here. I will have time for questions. I'll do the talk about study habits first, and then answer some questions about that. And then we'll go into some test taking strategies and then have a Q&A at the end. So the agenda for this evening is we're going to talk about some myths and legends surrounding study habits, and maybe some of the things that you're doing currently are good study habits that promote deep long-term memory, deep learning, and maybe some of the other things that you're doing are really talking about maybe some shallow short-term memory learning. And that's usually when you think you know it and you've read it so many times that you think you have it in your head, and then you open up the first question on the exam and your brain kind of explodes and it goes poof, and everything that you thought you knew is suddenly disappeared. And I know that nobody has ever had that experience. Some tips of what to do while you're reading, what you should be doing while you're reviewing and studying, a little bit of information about study groups and the best way to do study groups. And then we'll talk about some test taking strategies. So, and we need somebody to mute. I'm not sure where we are, but make sure you guys mute. Okay, so myth number one, learning is fast. Learning is not fast. It is time consuming, and you can't rush it. So don't try to study large volumes at one time. Break it into smaller chunks. Study a little bit every day versus like the weekend before the exam, studying for several hours. That is the best way. Cramming is the best way to basically get short-term memory, not deep learning, and having that experience when you open up the first question and all the stuff that you thought was in your head is suddenly gone. So do not cram, even if you can only do an hour in an evening, because I know you all have families and you have jobs and you have clinicals and everything else that you have to deal with. But if you can take an hour to just get by yourself, set a timer, study as much as you can for that period of time, and then go on to do the other things that you need to do. That will stay in your brain a lot longer than trying to cram for several hours a day or two before the exam. Myth number two, learning is facts, and memorizing facts does not help. Avoid using flashcards. Now, I know that in terminology, when I talk to students and they say, I use flashcards, what they're really talking about is they use note cards, and they put information about a topic or a concept on a note card so that it's portable. They can bring it with them to work. They can do it when they're waiting in a doctor's office or something like that. That's not truly a flashcard. A flashcard is when you put like a question on one side and the answer on the other side. So back in the day when you had to memorize lab values, now they put them on the NCLEX for you, so you don't have to memorize lab values. But back in the day when you used to have to do that, well, then flashcards were kind of helpful because you could kind of quiz yourself that way. But studying and trying to learn just facts is not going to be effective. You have to be able to learn the broad concepts and apply them to situations. So flashcards, if you use them as a study guide kind of thing, are fine, but don't use it for quizzing yourself. Avoid mindless rereading of your notes or your textbook. So I'm a firm believer that if you like reading the textbook, a lot of the stuff in the textbook, particularly Hone in MedSurg or any other MedSurg textbook that's out there, regardless of what a program happens to use, there's a lot of need to know stuff, but there's also a good amount of nice to know and crazy to know stuff. And it's really hard as you're just reading that chapter to figure out what's the need to know information. So unless you really want to get deep down into pathophysiology in that textbook, a lot deeper than you probably need to know, focus on the boxes, the tables, the highlighted things, the little alert things that they put in the textbook, because those are the important things. And then focus on what your instructor is guiding you towards when they're talking in lecture. Practice applying your facts to concepts. I know a lot of students say, I copy over my notes because, taking notes in class, it's, they're kind of messy and disorganized, and you try to, copy them over so they're more readable. It's more effective, rather than just copying them over, is to reorganize them. Put things into tables so that you have like a nice little table as a study guide. Do a concept map for a particular disease process that you're trying to learn. Put them in a compare contrast grid, focusing on what's similar, what's different, which I know is going to be very important for those of you in 110 who are learning fluid and electrolytes. And I know that that's a very high stress topic. And as I think some people have commented to Professor Hutchinson in the past, if you think you know a lot about fluid and electrolytes, you don't. And you just need to keep studying them. So putting them in a compare contrast grid can be very effective that way. But don't just copy over your notes. Myth number 2, myth number 3, I'm good at multitasking. Let's move this down to the bottom so it's less distracting here. No, we're not good at multitasking, and distractions are going to prevent deep learning. A lot of you love to sit and listen to music or watch TV while you're studying. Not really a good idea. You need to find a quiet room. You need to close the door. You need to turn off the TV, the radio. If your kids are old enough to read a sign on your door, when I was in graduate school, I had a sign on my room that said to my kids, is the house burning down? Is somebody bleeding? Is somebody not breathing? If not, leave me alone. Mom is studying. They can fend for themselves. Obviously, if you've got little kids, toddlers, you've got to maybe keep a half an eye out or try to get somebody to watch them. Set a timer for 45 to 50 minutes and then take a 10-minute break. That's about the length of time that your brain can absorb. And then you need a break. So, take a break, walk the dog, clean the bathroom really quick, make yourself a snack, go for a walk, do something to clear your brain. And you'll find when you get back to the studying, it'll be a lot more meaningful. You won't start to zone out or start thinking about things other than what you're trying to study. Now, once you've studied a particular area of content, do what we call teach it to the wall. So try to recall the content without looking at your notes or the textbook or any of the other study aids that you've created. Teach it to a person in your family if you can get them to sit long enough to talk about it, or just teach it to a picture on the wall, or do a brain dump onto a piece of paper. If you can talk about it, and if you can answer people's questions about it, then you really understand it. If you're stumbling, if you're constantly having to look back at your notes to refresh yourself on what the topic is about, then you don't really know it. If you can explain it in your own words without looking at your notes, you've got it and you understand it. Quiz yourself. There's a lot of different ways to quiz yourself. I do not recommend Quizlet. I know a lot of students like to use Quizlet. They are very simplistic questions. They're really not good, deep analysis, application level questions that are going to help you really learn and understand the material. You can generate questions yourself. I've actually used ChatGPT to generate questions for some of my exams. You do have to look at them, make sure that they're accurate, But those can really help you understand and make sure that you really understand that material. In your Honan book, if you bought the book, if you bought it new, or if you bought it used from somebody who didn't use the scratch off to register the book with PrepU with I think it's Evolve or the Point, Lippincott the Point. You can go into PrepU, you can click on the chapter that you're studying, and it will generate quizzes for you on that particular topic. You can go into ATI and do practice assessments, and you can do dynamic quizzing in ATI, where you go into My ATI, go into the assessment tab on My ATI, find dynamic quizzing, and then you can generate a practice exam with answers and rationales on any. You can either search by topic or you can click on a particular content area. And those are very, very good questions. And the rationales in ATI are very good. If you like concept maps, I personally am not a visual person. Concept maps are not my jam. But if you like concept maps, ATI has active learning templates. And I know a lot of you have used these for remediation assignments or other activities in your classes. But if you don't know where they are, you've never used them, you can go on to My ATI again. And at the top of the page, there is a link for the active learning templates, and you can download them in PDF, or I think even Microsoft Word. You could convert them to Word where you can actually type into them. But I find that if you handwrite when you're doing active learning templates, there's a lot more learning going on. If you copy and paste from from a Word document or something like that, you're not really learning it like you're learning it when you write it in there. So those are some resources that you can use to quiz yourself. For those of you who do highlighting, I stopped doing highlighting a long time ago because I found that when I was reading, I would highlight everything because everything seemed like it was important. And remember, when you highlight, you have to go back and read everything that you highlighted. The recommendation is that you read the section first without highlighting and pick out what the important information is as you're reading it, and then go back and do the highlighting. So highlight with purpose. Highlight distinctions, connections, applications. And so you really have to do multiple readings if you're going to highlight. Otherwise, it's really kind of a waste of time and a lot of yellow on the page that you're going to have to go back and read. So here's some techniques on how you can take the information that you're studying and try to organize it and put it into formats that help you really understand that information more than just a superficial way. Ask yourself, how does this concept relate to other concepts or my prior knowledge? A huge thing for those of you guys in like 100 and 110, the stuff you're learning now, you need to bring with you, because trust me, you will see fluid and electrolytes again. You will see ABGs again when you get to my course at the end of the program. You'll see it again when you get to PD and OB. So this is not just stuff you learn for the course and then forget about it until, and then go on to the next. So you're always bringing your prior knowledge with you. Ways that you can do that is to do compare contrast grids. For example, when you get in 200, when you're doing endocrine, comparing and contrasting the hypo and the hyper versions of the various endocrine conditions. In 110, you're doing fluid and electrolytes. Again, you're doing hypo and hyper of different labs, and you want to do like a compare contrast and pick out the things that are different about your concepts. What are similar? What are different? The difference is what's called distinction. So you're getting similarities and then you're focusing on the differences. So how is this concept different from the other concepts and my prior knowledge? So there's, again, where your compare contrast grids, your concept maps are going to help you get that organized into good material. And sometimes you have to ask yourself, how am I expected to use this information by my instructor? And we give you a lot of clues in class when we're doing our various activities, the case studies that you guys are doing, the gallery walks, your group work. All of that should give you an idea of this is what my professor wants me to do with the information that they're giving me. They want me to apply it. So much of the NCLEX are scenarios. They're the clinical judgment model that you're learning about. There's going to be the 18 questions out of the first 85 questions of the NCLEX are going to be case studies, 3 case studies with 6 questions each, like an unfolding case study, and applying those clinical judgment concepts to that. So be thinking about that all the time, not just memorizing what does this lab mean or what is this lab value, but what does it mean to my patient and why is it different in this patient and how are they feeling and what am I going to do about it? Always bring it out to that level and not just say, okay, I know that, I've memorized that lab value, I'm good. Do your practice questions. Use Chat GPT to create scenarios. You can literally go into Chat GPT and say, give me a case study about a patient with hypothyroidism, and including lab values and medications and diagnostic tests. And it will give you this wonderful case study. Again, check it for accuracy, but use it to help you apply that knowledge and figure out what it is that your instructor is going to want you to do with it. And now a good method of studying. And I find that when I've been tutoring students, that this has been very helpful for them. It's something called interleaving. And I know that at orientation, when Professor Legary and Wisniewski and Kanya, and I think maybe some other, depending on which orientation you guys were at, gave a little talk on study strategies during orientation. And one of the things they did talk about was interleaving. So it's a really good idea to alternate what you're studying. So say, for example, in my class, their first exam is on cardiovascular and respiratory. So I recommend that the first day that you study, and you should always start studying right off the bat, right at the beginning of the semester. Don't leave it to the end. So study maybe pulmonary embolism and acute respiratory failure one day. And then the next day, go on to respiratory traumas and chest tubes. And then the day after, go back and study the pulmonary embolism and acute respiratory failure that you did 2 days ago. So you're constantly alternating topics and concepts as you go through the weeks between exams. So you're always reviewing and you're not just doing all the respiratory one week and then all the cardiovascular the next week. And then all of a sudden it's the day before the exam and you go, oh, holy crap, I got to go back and review all that respiratory. And you don't remember any of it because it's been a week or 2 weeks since you looked at it. So do a little bit of something different every day. Go back and forth. It's called interleaving. You can do it within a study session. But I also recommend it every day, do something different. And then the next day, go back and look at what you did 2 days ago and try to see how much of it you remember. And you'll get an idea of what you still need to review on that. And it kind of keeps you from zoning out too. If you're studying all the same thing for several days in a row, after a while, you've read it so many times, you think you remember it, but really you're just remembering that you read it and not that you really remember it. So I know some people love to do study groups. Some people have very effective study groups. Some people have study groups that deteriorate very quickly into a gossip session and a coffee clatch. Other people like to just study on their own, and that's fine. I'm more of that type of person myself. If you have a study group, make an agenda and stick to it. Treat it like a business meeting. if for everybody that's going to come to that study group, make assignments, either, each person takes a chapter or each person takes a section. And maybe what you want to do is, everybody, each person bring 5 practice questions on that particular topic, on their assigned topic. And that way, and then you can quiz each other that way, or somebody can present their organized notes for a particular lecture, and everybody does a different lecture, and then you kind of share them. But you have to have an agenda, and you have to make everybody accountable for participating and contributing to that study group, so it doesn't deteriorate into a social time, which, we all like the social time, but if you're going to take time to do a study group, make it count. So questions, let me stop sharing and see if you have any questions for me about the study strategies that I just talked about. Anything you want me to elaborate on, explain further? No?
Don't everyone speak at once.
Well, I hopefully maybe it just means that I was just crystal clear, or either that or everybody's overwhelmed and and I was clear as mud, who knows. Um, okay, well, I mean, if you think of anything, we'll have another question at the end, but let's talk about some study strategies. Share. Okay, so test taking strategies. And this is the hardest thing to do, is don't read beyond the circumstances. I know a lot of you guys are coming from, you're working as, some of you are LPNs, some are EMTs, paramedics, nurses aides, CNAs, medical assistants, ED techs. Some of you have had a lot of different clinical experiences in your particular area of practice prior to coming to nursing school. So when you are looking at an NCLEX question, there is a tendency to look at the information that's in the question and say, I really want more information. I don't have in here what I need. So you start to say to yourself, what if? What if they're diabetic? What if they have COPD? You have to remember that what is in the question is the only information that you have to go on. So I tell students that I tutor, I said, pretend that the question, that NCLEX question that's lacking a lot of detail is like that really, really busy nurse who's giving you a really crappy report because they're in a hurry to get off and they don't want to answer any of your questions. They're just going blah, 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 blah. This patient was this, da, 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 see ya. And they're out the door. And you're going, but wait, but wait, but wait. What about, what about, what about? And they're gone. So now you have to figure out what to do for that patient or those patients that you got report on. And you can only do it based on the information that that nurse just gave you. That's how you have to look at an NCLEX question. Do not read into it. Take the words what if out of your vocabulary and just go with what that information is and answer it the best that you can. Second strategy, look for keywords. NCLEX questions will have a lot of keywords like what is the earliest sign of something or a late manifestation of something else? What is the first thing that you're going to do? A lot of the NCLEX is prioritizing. What are you going to do first? You're going to have to do all of it, but you got to figure out what's the first thing you're going to do. And we'll talk about prioritizing in a little bit. But look for those keywords that are going to give you the direction of where that question is leading you, so that you don't go down the wrong road. If you are a scanner, a person that just scans instead of reads every word, you need to slow yourself down and read every word so you don't miss those key words. I can't count the number of times students have come to me after an exam and said, oh, I missed that word except, or which of these are not a sign or symptom of whatever. And they missed the word not. So just read very carefully and look for those keywords. So prioritizing. ABCs are almost always the first priority, so airway, breathing, circulation. But the sick, twisted people who write those NCLEX questions know that you've had ABCs drummed into you. So they may put a breathing and airway option as one of the options, but it doesn't fit the scenario. But they could trick you into picking it because of that whole ABCs that you've been taught. So always look at that with a grain of salt and say, okay, this is an airway or breathing option, but does it fit the scenario? So for example, if I'm talking about a fractured ankle, I'm not concerned about airway breathing. I'm concerned about circulation. And there's nothing in the question that says that person with the fractured ankle has any kind of breathing problem. So don't get tricked. You can prioritize using Maslow's hierarchy of needs. So physiological concerns and needs are always going to be the highest priority. Safety is going to be a very high priority, but there may be some situations where safety is not as big of a concern as some other physiological need. Put this up here now. Prioritize using the steps of the nursing process. So assess first. If you have the option to gather more data, get more information, do that first before you dive in and do something like perform some sort of an intervention or give a medication or a treatment. Gather more data. Now, the only exception to that would be if you were in an emergency situation where gathering more data could put the patient at risk, at further risk, and wouldn't really contribute to what your decision is going to be. And that really the best and most important thing is to jump in and do something, then assessment may not be. But most of the time on an NCLEX question, gather more data, assess first. That's the first step of the nursing process. You look at systemic issues versus localized or peripheral issues, life over limb. Something is life-threatening. That's going to be your highest priority. If you are looking at the acute versus chronic, so you're learning in your earlier courses in nursing about various chronic conditions, and then farther on that you get in the program, you're learning about more acute situations. So knowing what the chronic changes are for somebody, for example, with COPD, what you would expect with their ABGs. They're not going to be normal, but it's normal for them versus acute exacerbations or decompensations, being able to differentiate between those so that you pick the right person, the most acutely ill person. You worry about actual versus potential problems, and you focus on trends as opposed to transient findings. And that's one of the things on the clinical judgment model on the NCLEX that they really focus. There are specific trend category questions where you are looking at a series of vital signs or a series of lab values and looking at whether or not the trend is in a positive or negative direction or if they're unchanged and what we need to worry about. So you're focusing on the trends, and that's what you should be looking at with your patients all the time. Not just that right now their blood pressure is 140 over 90. Is that a trend, or was that just an isolated issue and maybe a half an hour later you go back and their blood pressure is fine? You need to focus on the signs and symptoms of emergencies or complications versus the expected findings. That kind of goes back to the acute versus chronic. And another way that you can look at in terms of prioritizing patients is the time that has elapsed from the surgical procedure, the incident, the admission, that sort of thing. The most recent is going to be the most critical. That's going to be your most unstable patient. Somebody who had a heart attack a week ago is going to be less critical than somebody who had a heart attack today. So assessment, first step in the nursing process. If it's not an option, go to the next step, and always try to do more assessment, more collection of data before you move to the next step. You need to understand principles of physiologic response and then interpret the data. It's not enough to know that the ABGs are abnormal. You need to know why and what you're going to do about them. It's not enough to know that the blood sugar is 400. You need to know why, and you need to know what to do about it. Focus on nursing actions versus medical actions. You have to ask yourself, is this something in my scope of practice? So if you are a person, if you are taking a phone call from a patient and there's a problem with that particular patient, you cannot tell them, oh, take XYZ medication. That's not your scope of practice. Unless you're working off of a standardized plan of care and an algorithm that's been signed off by the physician, you cannot tell them, okay, you need to take this medication. You have to check with the doctor to pass that along to them. Another thing that students get hung up on NCLEX questions, you need to focus only on the client that's in the question and answer it as if it's your only client, even though you will probably have 4 or 5 other clients. But there won't be any distractions if you're in NCLEX land. And in NCLEX land, you are the only person in the room. You have to do everything that's in the question, and you can only do one thing at a time. So there's a scenario, and they say, okay, what are you going to do first, or put in an order of priority? You can't say, well, in real life, while I'm putting in that IV, somebody else is hooking up the oxygen and somebody else is, doing something else, drawing the labs or whatever. In NCLEX land, you're the only person in the room. You have to do everything. You can only do one thing at a time. So they want to know if you know what the first thing is that you have to do, or what order you have to do these things in terms of prioritizing. So don't assume you have any help when it comes to NCLEX land. That's, real life versus NCLEX land. True or false options. And so these are the questions that kind of make you flip your brain backwards. And they usually end with this phrase like, which statement by the patient indicates the need for further instruction? So you have to pick the wrong statement by the patient as the right answer to the question. So a method that you can use for those types of questions is a true-false option. So read the question, make sure that you understand that, okay, I have to pick the wrong action or the wrong statement by the patient because that'll be the correct answer to the question. So you go through and you take each option individually and say, is this option true as it relates to the question? So is this something the patient should say? And you would mark it true. Is this something the patient should say? And you mark it true. And then you get to one, is this something the patient should not say? Then you mark it false. And so hopefully you will have 3 true and 1 false. So the false option is the correct answer to the question. The incorrect answer from the patient's point of view, but the correct answer to the question. So those are very confusing questions. When I took my certified nurse educator exam, there were a lot of those kinds of questions, and I had to use this strategy, and it worked. Therapeutic communication. So all the principles of therapeutic communication that you learned in Nursing 100. The big thing on NCLEX is if your response contains the word why, it is the wrong response. You do not use why. You don't ask why. Why is confrontational, puts people on the defensive. It is a principle of something that you should not use when it comes to therapeutic communication. So even though the answer, or the question that you're asking the patient sounds right, If it contains the word why, avoid it like the plague. Find something that's similar to that that doesn't use the word why. And a psych instructor told me one time that it is particularly important when dealing with psychiatric patients because they literally do not know why. There's a chemical imbalance in their brain. They don't know why they're acting or feeling or talking or seeing or hearing the things that are happening to them. They literally do not know why. And that can make them very anxious and even angry. So don't ask why. Eliminate the similar, pick the one that's different. So just using the process of elimination. Even if you don't like any of the answers, you should be able to eliminate 3 of them as just not being correct at all, versus one of them that may not be one that you like, but it's closest to the correct answer that you can find. Pick that one. If an answer on a question contains an absolute, like you should always do this, you tell the patient, or you should never do that. Oftentimes those will make a question or an answer incorrect. So look for absolutes. This is particularly helpful when you get it down to 2 answers that are very, very similar, that I know everybody gets to that point and you can't figure out which one is the best one. Look and see if one of them has an absolute in that. Eliminate that and pick the other one. Look for umbrella or global options. So you may have 1 or 2 or all 4 of the options are kind of within that same category and they all look to be kind of right. But maybe one of those will be a broader statement that encompasses the meaning of all the other ones. So it's what's called an umbrella or global option. So pick the one that's a broad statement rather than one that's very, very specific. Delegation guidelines. Whoops, let's go back to that. I wasn't sure if I had enough. Okay. So you need to know scope of practice. The RN is responsible for the nursing process. So you cannot delegate nursing process to the LPN or the UAP, which means that you have to do the initial assessment for that patient, because assessment is part of the nursing process. You can delegate collection of data to the LPN or even the UAP. They are allowed to, particularly the LPNs, they use the same assessment techniques that we all use, but they are collecting data to contribute to the plan of care. You are assessing that data in order to develop that plan of care and evaluate that plan of care. So you cannot delegate the initial assessment of the patient when they come to you from the emergency room, or they're admitted from home, or they're coming to you from PACU. But you can delegate follow-up data collection to the LPN. Same thing with teaching. You need to develop the teaching plan, you need to initiate teaching, and then you can delegate follow-up teaching to the LPN. You can delegate certain portions and even some invasive procedures to UAPs if they've been specifically trained for them, like a finger stick. I mean, technically that's an invasive procedure. They've been trained to do a finger stick glucose. They will collect that data and bring it to you. You are the person who determines what that means, how it's impacting the patient, and what you're going to do about it. This does not mean, and I always make this very, very clear when I talk, this because I started off as an LPN. This does not mean that LPNs and UAPs are not smart enough to know what that data means. It is not their scope of practice to evaluate it and do something about it. That is your scope of practice as the RN. So it doesn't mean they don't know that there's a problem and they don't understand that there's a problem, but it's your responsibility as the RN to evaluate and do something about that. So just remember scope of practice. And the most complex critically ill patient, if you're trying to delegate, which patients you give to the RN, which you're the charge nurse, which patient you give to the LPN, you need to give the most critically ill, unstable patients to the RN the more stable patients would go to the LPN. Select all that apply. Now, there is going to be a lot of select all that apply on the NCLEX. The nice thing about select all that apply now is that they do give you partial credit. And an even nicer thing on some of the next gen NCLEX format questions, they actually tell you how many to select. Which of these, which are the four most important things to do in this situation, or which three interventions need to be accomplished out of these seven or whatever. So those are really a gift where they're telling you exactly how many to pick. But you do get partial credit. The problem is also with NCLEX now is that it used to be that there would always be at least one that didn't apply. So if you had, seven options, you knew the max that you had to pick would be six. There was always one that wasn't. Well, that changed a few years ago. Now it could be anywhere from one all the way to all of them. So you really do have to think about your select all that apply questions. So what I recommend that you do with select all that apply, read the question very, very carefully to understand where is the focus of the question, what are they asking me, and then take each option one at a time, because I know the tendency is to read through them all and you keep circling around and around and around, and then after a while you're very confused. Take one option at a time and say, is this true or false as it relates to the question? And that's the important thing, as it relates to the question, because it could be a true statement in another situation, but not true for this particular scenario. So is it true as it relates to the question? Mark it true or false, go through the list one by one and mark them true or false. And then everything that you marked true is your select all that apply. Try not to second guess yourself. Try not to keep repeating and going back and forth and around and around. Pick one, read one, make a decision, move on. Changing answers. Now, for some of you, I think up until the middle of Nursing 200, you are allowed to go back and check your questions and maybe even change your answers, which you shouldn't do. But once you get to the middle of Nursing 200, all of your exams from that point on are forward only, where you cannot go back, because that's the NCLEX. With the NCLEX, you answer a question, you click submit, and you move on, and you will never see that question again, and you can't go back and double check it or change your mind or change your answer or whatever. So get into the habit of not changing your answers. Spend the time you need on the question, think about it, double check, make sure you read the question carefully, make your decision, and move on. If you're able to still go back in 100 and 110, be really, really careful about not changing your answers, because usually the first answer that you come up with, your gut answer, is the correct one. When you go back, you start second guessing yourself and reading too much into the question and doing the what ifs. So only if you are 100% sure that you chose the wrong answer, don't change it. Because I cannot count the number of students who come to me saying, if I hadn't changed 5 answers, I wouldn't be coming for tutoring because I would have passed this exam. Cover your answers. So this goes back to reading the question carefully and thoroughly. If you are the type of person that gets halfway through the question and then says, oh, I know where this is going, and you jump down to start looking at the answers, and then an answer jumps out at you as being really, really good because it has all the buzzwords that your professor was talking about in class, and it just looks right, and you want to pick it and you fall in love with it, and then you remind yourself, oh, wait a minute, I should have read the whole question. You go back and read the question, and now you tend to morph the question, the meaning of the question, to fit the answer that you fell in love with, which may or may not be the correct answer. If you do that, and you know who you are that do it, take your scrap paper, hold it up, and cover the answers, And that forces you to read the question more carefully and read every word in the question and then formulate what you think might be a good answer to that question. Then uncover your answers. And a lot of times there'll be an answer on there very similar to the one that you formulated as a possible answer to that question. So if you are one of those people who likes to jump down and look at the answers before you're done reading the question, cover the answers. Students who do that swear by it. They have really, really been very successful of not, second guessing themselves with that. So cover your answers. And let's talk about medications. They do not give trade names on the NCLEX anymore. They haven't done that for several years. They will only give the generic names. Remember, clients should never adjust or change their dose or stop abruptly. They should always be talking to their physicians. You cannot even recommend over-the-counter drugs without an order from the physician. So unless you're working off of a protocol where the doctor has said, if the patient calls and they report a fever of 101.1, you may recommend that they take 2 Tylenol Q4 hours as needed. Otherwise, you cannot even recommend an over-the-counter drug unless you have an order. You never give the med when the order is difficult to read or unclear or an abnormal dose. And so NCLEX will expect that you know the normal doses of common medications, not the outliers that you hardly ever see, but common medications like DIG, like certain antibiotics, things that you're giving all the time. They expect you to know those normal doses. If you can't figure out what the medication is, look at the diagnosis. If they're talking about a respiratory diagnosis and you're asking you about a particular medication, you can say, well, I can assume this time you can read into the question because you're clueless at that point. So say, okay, it's a respiratory condition. So I'm assuming it's a respiratory med. So what do I know about respiratory med? So you start thinking, bronchodilators, and you start thinking about corticosteroids, and what do I know about the side effects and the precautions and things? And it'll give you a fighting chance on this med that you know nothing about. Because with the NCLEX, it's answering the question to the best of your ability, quality, not quantity. So you always have to give it your best shot. Look for commonalities in medication names to identify the classification. So the OLOLs are the beta blockers, and the PRILs are the ACE inhibitors, and the mycins are antibiotics. And then once okay, so it's a name you don't recognize, but it's got one of those endings. Now I know what category it belongs to. What do I know about that category? Learn the different categories of meds. Don't try to memorize every single medication. And then link the common side effects with nursing interventions. So if you know that a particular med has, for example, it slows down the heart rate, beta blockers slow down the heart rate. So nursing interventions are going to be things like taking an apical pulse before you give it, assessing for that patient for possibly developing bradycardia. So take those common side effects, and then that will help you with your nursing actions and your interventions. So questions about test-taking strategies, study strategies, anything that I didn't touch on that you had a question about that I might be able to help you with? Let me check the chat. I guess somebody said, Haley says, I've been doing almost all of what she said. A time to reevaluate. Yeah. I think one of the things that happens when you come to nursing school is that a lot of the study habits that served you well in some of your prerequisites are not going to work as effectively when you come to nursing school, because it's a, as you found already, it's a whole different beast of how you approach test questions, how you approach studying, how you take what you learn in class and apply it to clinical. I mean, there's so many moving parts to nursing school, that hopefully I've given you some things to reflect on. As I said, I will give the link for this YouTube recording. Oh, how can I tackle reading Honan without feeling so overwhelmed? Yeah, it is pretty overwhelming. Um, what I tell my students to do, because they're like, particularly for neuro, when you guys get to 220, it's like 3 or 4 chapters. It's ridiculous. Um, I tell them to, look at the PowerPoints, because that's my need to know information. I have YouTube videos. I know some of your professors have voiceover PowerPoints of the need to know information. When you get into Honan, what you can look at is your unit objectives that your instructor has said, for that particular unit. So if it's for diabetes and Professor Hutchinson, these are the unit objectives. Kind of scan through the chapters. Don't try to read every single word. Go look at like chapter headings or section headings, and see, okay, well, this applies to this particular unit objective. I'm going to read through this section and see, make sure that I understand what this. So use the unit objectives to guide your reading rather than trying to read every single page. And, like I said before, focus on charts and tables and graphs and diagrams that we are directing you to. Yeah, the AP pathos stuff, if and that's one of the things that we always have said, and our previous program director, Jan Watts, used to always say, if you understand the normal A and P, then you'll be able to figure out what the abnormal is. So if you need to review the A and P when you get into those chapters, then, because you haven't really brought enough of it with you, um, the knowing the normal A and P is going to help you figure out what abnormal is going to look like. So if you're confident with the normal A and P, skip over that section in Honan. Because again, there's a lot of stuff in there that's kind of crazy to know. It goes so deep into the pathophysiology sometimes. It's like, no, we're not nurse practitioners. This is for entry-level nurses. We don't need to know most of the time we don't need to know what's happening at the cellular level. There's a few things in my class that, yeah, you do need to know what's happening at the cellular level, but I make it, simplistic. Um, but sometimes, a lot of times you don't need, just like with meds, the psychopharmacology and all that, the chemical and all that stuff. If you can explain, if it's too complicated for you to understand, you need to be able to explain it to your patient. This is what the medication is going to do for you. If you understand that, then you're going to be good. Let me look in the chat again. 1 10-hour pre-lecture questions used in later course. So in 110, and I know in my class in 220, I give you guys a video. I've done it's basically a voiceover PowerPoint. It's a YouTube video, and I give you the notes that go along with it, my lecture notes that go along with it, and that's your need to know information. And then we do quizzes, ATI quizzes in class. For your final for nursing 100, okay, for strategy, since it's a lot to study, what I would do again is go back, for if you're having a comprehensive final exam, then go back to all of your unit objectives. And remember, your final exam, I don't know how many questions there are going to be, but let's say there's 70 questions on your final exam, and you've got, when you put them all together, you've got maybe 70 unit objectives. If, try to prioritize, try to focus on the things that your professor has, that, your professor has really focused on, then chances are that's going to show up again on your final exam. Probably not not the same question that you had on a previous test, but if it was important enough to be on the unit test, something on that concept or content or topic is probably going to be on your final. Yeah, study groups, but with an agenda. Yeah. I used to have in grad school, I'm not a group work person either. I like to study on my own. I like to stand or fall on my own when it comes to a graded assignment, but we had to do a lot of group projects. And if we didn't have an agenda, it would just deteriorate into, oh my God, well, because we were all practicing nurses at the time, and it was like what our patients had done that day, or what our boss had said to us, or things going on in our families, and we ended up not even working on the project. So you really do have to have an agenda. I hope you guys know that you're able to book study rooms in the library. Uh, so, so that's an option too if you want to try to avoid going to like a restaurant or a Starbucks or something like that to do, or somebody's house to do your study groups. You can book rooms in the library. Yeah. Also ask Professor Claudia what she thinks you may need to brush up on. Yeah, yeah. She'll have a good thing. If you've had to do any tutoring, or if you struggled on any of your exams, I would suggest that would be the content that you need to really look at for your final. These are really good questions. Anybody have any other questions? Okay, well, I am going to stop the recording. Actually, I'll stop it in a second. But I will see you guys in Nursing 220. And if I have any ABSN students in the group, I will probably see you in Nursing 450, or I think now it's being called Nursing 452, in the fall of 2025. But for the rest of you, it'll be Nursing 220. Thank you so much, guys. Good
Thank you
luck
so
on your
much, Pam.
finals. Bye bye.
Bye. Thank you. Have a good
Thanks.
night.
Good night.
Thank you. Good night.